the topic at an organizational level. Burns is one of the toughest units to organize because it requires a lot of technicians. It requires a surgeon, a burn surgeon. It requires good nursing team. It requires a good psychologist and a psychiatrist to handle the trauma part of the patient. It requires a good OT table, a dressing room, a good clinical microbiologist to treat the infections, and it requires dietitians, physiotherapists, and it requires intensivist, anesthesiologist, and respiratory physician. Also, it can lead to amputations, and therefore it requires a lot of orthotic contribution also. Okay, so this is the basic structure of a burns unit. But the boss of the burns unit will always be an experienced burns surgeon. We also require a lot of social worker and occupational therapists, because most of the burns patients might have lost their livelihood, and social workers and occupational therapists will be great in rehabilitating their life. Burns. The cause of burns injury are dime a dozen. Okay, there can be a flame, there can be hot liquids, which is then called as a scalp burns. There can be a contact burns. The contact can be with hot material like hot solids or hot liquids. There can be chemical contact, and finally there can be electrical injuries. Okay, flame burns are because of superheated air by convection and radiation. So even radiation injuries is a form of flame burns only. In flame burns, scald and contact burns, coagulative necrosis of the epidermis and the underlying tissue takes place. There are cellular damage by transfer of energy. Whereas in electrical burns and chemical burns, the injury is mainly a coagulation necrosis or liquefactive necrosis, though transfer of heat can cause a coagulation necrosis. So there is a combination of coagulation and liquefactive necrosis in case of electrical and chemical burns. Jackson zones is very important to understand how the healing process of burns takes place. Jackson zones are of three types. The centralmost burn area, which has already undergone coagulation due to the heat damage, is called as the zone of coagulation. This is a necrotic area. The tissue here is irreversibly damaged. Second comes the zone of stasis area, the one in the green area. Okay, this area is of moderate degree of insult. Because of the insult of the burns, there is decrease in perfusion. Okay, there is vascular damage and vessel leakage due to opening up of the capillaries. So this zone is the crucial zone to limit the damage by a doctor. If proper resuscitation, proper fluid care and proper wound care is not taken, then this zone of stasis expands and becomes a zone of coagulation. If proper resuscitation, good antibiotics, and no infection is there, this can get converted into the final zone called as the zone of hyperemia. So hyperemia zone is the outermost zone, okay, in which there is a lot of inflammation, and it contains a clearly viable tissue from which the healing process begins. Therefore, the intermediate zone converting into zone of hyperemia helps in faster healing also, and usually the zone of hyperemia is not at the risk of necrosis. Because the intermediate zone or the zone of stasis is the critical zone which is mainly targeted by us for the treatment of burns, many of the pharmacological agents have been used to decrease the expansion of the zone of stasis to coagulation, like inhibitors of thromboxane A2. The depth of the burn is very important to prognosticate how the burns will heal, whether it will heal with a treatment or without treatment, and how is it systemic complications are going to be. This is a cut section of the skin wherein you can see the epidermis, the dermis. In the dermis, the upper part is called as the papillary dermis and the deeper part is called as the reticular dermis, below which is the hypodermis, and below which is the body tissues like muscles, joint, upper neurosis, neurovascular structures, etc. Okay, whenever there is injury to only the epidermis, it is called as a first degree burns. When there is damage to the epidermis and part of the dermis only involving the papillary dermis, it is called as a superficial second degree burns. When there is damage of the deep reticular dermis, then it is called as the deep second degree burns or second degree deep partial thickness burns. From here, from deep second degree deep partial thickness burns, the management actually changes. And if the subcutaneous fat is also involved, it is called as the third degree burns. And any exposure of the any structures below the subcutaneous fat is called as the third degree burns, which is called as the fourth degree burns, which most commonly happens in cases of electric.